SARPE in Japan. If you're watching this video, you probably already know what SARPE is, but just in case you don't, it's surgically assisted rapid palatal expansion. So what they do is expand your upper jaw. My situation is my upper jaw was V-shaped, so they're expanding it through surgery to make it more of a U shape like normal people. So I'm going to talk about the process in Japan and how it went for me. So keep in mind it varies person to person. But when I was thinking about getting this, I was looking for videos of people who did it in Japan, but I could not find one. If you have any questions, let me know. I'll try my best to explain the process and how it went for me. As of right now, I'm about 3 weeks post-surgery, and I'll let you know how things go. So first, I was referred to the Tokyo Dental College Suidobashi Hospital. They were the only ones who could do this in Japan. That's right near Suidobashi Station, which is the Tokyo Dome station. I went and talked to the orthodontist as well as the surgeon. They explained the procedure, and they went ahead and put braces on my top and bottom teeth. Now the surgery is on the top, so they put regular braces on at first, but eventually they put braces on the top that began to create an opening. And once you have a particular diameter between your two front teeth, like I have right now, this is post-surgery, but I do have a gap in between. So once they have a particular diameter, they'll go ahead and schedule your surgery. So, of course, it's a little bit complicated brushing your braces. You have to be very careful, and they'll explain that to you. But the main thing is, let me explain the process for you. Let me see. After that, now, going to the hospital, it's a 6-day hospital stay at their hospital. And when I had it done, it was kind of as COVID was winding down, 6 days in the hospital, not allowed to go out of the hospital. Nobody could come in to visit you in your room. So it was very hard. But post-surgery, you can only eat a liquid diet. Like, so you're basically drinking any liquid and lots of soup. So be prepared to lose a lot of weight. You'll be on a liquid diet for quite a while. I lost 10 kilograms post-surgery as of right now. And I've been eating like jelly, drinkable jellies, soup, juice, and I have not gained weight. I mean, I'm not eating any solid food. So it'll vary from person to person, but as far as in the hospital when the surgery was done, I felt some pain. It wasn't a whole lot. Like the most painful days will be the first 3 days. Those are the toughest. But they give you plenty of Roxonin, the painkillers to manage your pain. They ask you, like, how's your pain and whatnot. And you give them a number, and they tell you how much Roxonin to take. But, don't overtake it, they tell you. But, again, for me, it wasn't that bad. It wasn't unbearable. And one of the big concerns for me, because I was a teacher, is that, will I be able to talk after? So next day, I called my mom, talking. It'll take time to get used to they put this device in your mouth. It's kind of hard to see here, but they put a device called an expander in your mouth that will help you after the surgery to expand your jaw even further. So basically the operation will weaken your jaw, and after the operation you might feel some, of course, pain, numbness, and you'll have many follow-up appointments with the surgery department to make sure you're doing okay after you're released from the hospital. So they give you this little key here, and you stick this key in your mouth to expand. And again, once you get to a certain diameter, I think it's 6 millimeters, you stop expanding your jaw with this key. But right now I'm at about 4 millimeters, and I have about 2 weeks or so to go. And we're trying to get to the goal of 6 millimeters, and you'll stop. But this is kind of hard to do. So it's easier. You can do it by yourself, but it's easier if someone else does it for you. But even for them, they will have a hard time doing it. It hasn't been too painful for me doing this, but yeah, that's about it. I mean, like my main concerns were how much pain would it be, and for me, it wasn't even that much pain to where it was like unbearable pain, and I don't want to go anywhere and do anything. I was going about my business and doing things, and I was on summer vacation, so I'm going here and there. And as far as being able to be understood when I'm talking was another major concern, and that was not really a big issue. I mean, you have the device in your mouth, the expander, and it just takes time to get used to it. Just like when you wear braces, it takes time to get used to it. Same thing. Just it's hard to pronounce certain words because you have the gap in between. So as you can see, I said about 4 millimeters right now. So yeah, it'll get a little bit bigger. So that's about it. If you have any questions, please let me know. But so far, I've had a good experience at the hospital other than the stay, not being able to go out. That was boring, obviously. Yeah, and I was able to use my insurance, which helped out a lot, but that's not always the case. It will vary, and that's pending approval. So if there's any questions I can answer for you, please let me know in the chat, and I'll make another video if necessary. But, you know, if you're worried about doing this, I highly recommend it. I don't know the end result yet, but maybe I'll follow up in a few months or weeks or something to let you know how I'm doing. But that's the basic process, and if you're thinking about doing it, don't worry too much, I would say. Go for it. And it wasn't too bad for me. But again, like I said, it could vary person to person. Thanks for watching, and I hope this was helpful for you.